Hey doctors, welcome. Today, we're diving into a crucial topic that affects your day-to-day workflow: prior authorization in the U.S. healthcare system. If you've been in the healthcare field for a while, you know how time-consuming and complex this process can be. But don't worry, we're here to make it a little bit easier for you. Prior authorization, or PA, is the process where healthcare providers need to get approval from a patient's insurance company before performing certain procedures, prescribing medications, or ordering tests. It's there to make sure that the care you provide is medically necessary and covered by the patient's insurance. However, navigating this process can be a real headache, and if things aren't done correctly, it can delay patient care. Step 1. Identify which services need prior authorization. Not all treatments require this, so it's essential to know which ones do. Each insurance company has a list, and you can usually find it on their provider portal. Make sure your team is updated regularly, so you don't waste time on unnecessary requests. Next, gather all the necessary patient and clinical information. We're talking insurance details, clinical notes, test results, and a clear justification for why the service is needed. The more complete your documentation, the less chance you'll have of getting a denial or a request for more info. Now, it's time to submit the prior authorization request. Whether you do this online, via fax, or on the phone, make sure you follow the insurer's submission guidelines carefully. And don't forget to document everything: dates, communications, you name it. This is crucial for follow-ups. Speaking of follow-ups, step 4 is to track the status of your request. Many insurers offer portals or phone lines for you to check the status. Don't wait too long, keep checking in to ensure everything is moving along smoothly. If it's denied, understand why and decide whether to appeal or modify your treatment plan. Now, here's the good part: how can Staffingly help you out? If you're tired of the administrative burden, Staffingly's healthcare outsourcing services can make this process a whole lot smoother. We help with accurate documentation, timely submission and follow-ups, and real-time updates, so you're always in the loop. This means faster PA approvals, less paperwork, and more time for you to focus on what really matters: your patients. If you found this video helpful, make sure to hit the like button, share it with your peers, and subscribe for more practical tips to improve your healthcare practice. Thanks for watching, doctors, and see you in the next video.